Hello, my name is Naseem H Siddiqi. I'm a nephrologist. I'm giving this talk for general knowledge about kidney disease to general public. It is given to you, sponsored by Siddiqi Foundation. It is not to be taken as a treatment or advice for kidney disease, but it is to understand what kidney disease can do for you and how to manage yourself. So if you have any particular questions, you need to take it to your uh, family practice internist or a nephrologist. If you have any particular question about any medications for kidney disease, you need to talk to them or a pharmacist. So therefore, this talk is only given for general understanding about kidney disease. As the population is getting older, there's more kidney disease in the general population. My topic today is CKD, chronic kidney disease. Chronic kidney disease manifests itself by various things. One of them is having protein in the urine and a reduction of GFR. GFR stands for glomerular filtration rate. Nowadays we can calculate that by using a serum creatinine. This is a progressive disease, therefore to manage it early in the game will save you a lot of trouble later. A lot of patients go on dialysis because kidney does not give any kind of symptoms initially, and therefore the kidney disease can be rampant and you may not know it. GFR is calculated by MDRD equation. CKD epi-creatinine equation, epi-cysteine and creatinine equation, Cockcroft-Gault formula, and these calculations does not corroborate with the younger people age 17 or lower. Therefore, another equation is used called Schwarz formula to calculate. There are 5 stages of kidney disease, and stage 1 is kidney GFR is around 90 or lower. Stage 2 between 60 and 89. Stage 3 is between 30 and 59. Stage 4 is 15 or lower, 15 to 29, and stage 5 is 15 or lower. In the stage 5, you could need not to have dialysis, but if there's a need for dialysis, then this stage 5 is calculated, and if your kidney functions go down so much and you have a lot of symptoms, then you may be requiring dialysis. Usually GFR drops below 10 or so and the patient is symptomatic, then the nephrologist puts you on dialysis. This of course is you come into category of chronic kidney disease and needing dialysis. That means your dialysis requirement may be permanent. There are multiple causes of chronic kidney disease, and major cause is hypertension, diabetes mellitus type 2. Some patients may have kidney stones that can also lead to kidney disease. Some patients may have cystic kidney disease, and some may have prostate problem, which can lead to kidney disease, but usually it's reversible if obstruction is for a short while. Then there is a familial disease that is like Alport syndrome, congenital kidney disease. Children are born with smaller kidneys, or one kidney could be smaller than the other. Then, of course, lupus, cancers, and nephritis. Nephritis is one of the major causes of it. You can have also kidney disease from taking some medication which may be injurious to you. And those medicines could be non-steroidal that you take for arthritis, Motrin, or similar medications. Some drug usage can also do that. So to fight the kidney disease, one has to use take care of the blood pressure. Blood pressure has to be controlled with one medication or diuretics or ACE inhibitors or ARB. There are multiple antihypertensive medications that your doctor will prescribe for you. Blood pressure should be controlled under 120, the top number, the bottom number 80. Obesity should be controlled by weight reduction, exercise, cut down the salt, eat fruits and vegetables, but there is some limitation. Sometimes your potassium may be high, or some fruits may not be prescribed, advised for you. Fish and chicken is good protein. Of course, there are certain meats like beef and pork. They may contain more cholesterol in them. Cut down the carbohydrate. Fluid intake, there are some limitations for fluid. Sometimes the doctors will tell you to drink more fluid, but if you have a lot of edema or congestive heart failure along with it, then he will limit your fluid and your salt. Smoking is a major problem because it not only produces lung problems, cancer, but it also narrows down your blood vessels. Kidney survival depend upon good vessels. Of course, the kidney takes tremendous amount of circulation to be effective. Kidney not only take care of your fluid balance, blood pressure control, but it also does other things. Like there are hormones such as erythropoietin that produces blood through bone marrow. So kidney is much more complex organ than one can see. It also helps in bone formation as well as calcium metabolism. Magnesium and other minerals are also controlled by the kidney. Diabetes control, hemoglobin A1C, which tells you about last 3 months control of your sugar, should be less than 7. Of course, diabetes can lead to other problems besides the kidneys, such as eyes. Your eyes can get affected from it. You can have bleeding in the eyes as well as high pressure in the eye. One can become blind because of the diabetes. It should be controlled. Your feet and your arms, they can have some problem with numbness and restless leg syndrome. Those needs to get under control by controlling the diabetes. Sometimes the diabetes goes out of control when you have advanced kidney disease. It's very difficult at that time, especially when you are on dialysis. Blood sugar may fluctuate tremendously. It may go way up, way down. Sometimes the patient's diabetes get better control, and the patient is very happy that my diabetes is under control. But the fact is that your own insulin goes out through the kidneys. So therefore, more insulin is available to your body, and therefore diabetes get under control. But that's one of the observations that we make when we deal with the kidney patients. Cholesterol is also a major problem because it can lead to narrowness of the blood vessels. So therefore, cholesterol needs to get under control. Sometimes the cholesterol medicines go against you as well if you develop muscle pain, and therefore your doctor will take care of that part. In case that happens, you need to inform the doctor. Avoid the non-steroidal, the arthritis medicines needs to get looked at by your doctor, and make sure that you do not use non-steroidal medications if you have kidney failure. Avoid metformin. Metformin is a great drug, but it can lead to other complications if you have advanced kidney disease, and it can lead to lactic acidosis, and therefore it could be dangerous for you. One has to be very careful with putting an IV dye in you, like you are getting an angiogram done, so make sure you talk to your own doctor and cardiologist who's going to take care of you. Some the contrast material is given IV, and that may not be good for you. But if you have very advanced kidney disease, even the contrast given for MRI is not recommended because it can lead to other complications. When you are given the antibiotics, those antibiotics have to be looked at by your doctor or nephrologist, because your requirement for antibiotic dosage is different, and some of the antibiotics can lead to kidney disease, as well as some of the antibiotics can lead to some problem with hearing as well, because they could be injurious to your hearing, as they will stay in the system, in your body system long time. Stress reduction, you need to reduce your stress, as well as take care of your heart disease, because whenever you have a kidney disease, you tend to have the heart disease as well. Sleep problems can occur, or restlessness can occur, and that needs to be taken care of. Some patients who are obese, they may have a sleep apnea problem, and that needs to be taken care of. People who have sleep apnea, they also have hypertension. From time to time, your physician will do your blood test, and which could include sodium, potassium, carbon dioxide, serum creatinine, BUN. Uric acid, people may have gout, or the uric acid may be high. Sometimes even if you don't have symptoms of gout, your uric acid may be high. So uric acid may be reduced to 6 or below. Some of the laboratory may show high number as being normal. PTH, there are 4 little glands around your thyroid gland called parathyroid hormone, parathyroid gland, and those secrete parathyroid hormone, and the parathyroid gland become overactive, and they can lead to problem with your bones. The bones can become hollow. Some of the patients may have vitamin D deficiency, therefore vitamin D needs to be replaced in some of the patients. There is another kind of vitamin D that we use to suppress the parathyroid gland. Those vitamins are called vitamin D analog. From time to time, your doctor will do a complete blood count to see if you are developing anemia. You may need IV iron or by mouth iron supplements, and some of the patients may require multivitamin along the other vitamins. Your doctor may do a urine test for you to see how much urine you are spilling out. May do a 24 hours urine, depending upon your own condition. If you have nephritis, that needs to get looked at. You may have urinary tract infection. Your doctor may like to do an ultrasound of the kidney, but sometimes the CT scan is necessary. Plasma renin level may need to be done from time to time. Some of the patients may have problem with renal artery, that means artery which goes to your kidney. Both of them could be blocked because of some medical condition that you may have. So that question will be decided by the nephrologist. So to make your condition more optimal, the doctor may have to give you medication, and blood pressure control, diabetes control is very important. All the other medication that I had talked about, supplements to be given to you. Once your condition calls for needing dialysis, then the doctor may place you on chronic hemodialysis in center as well as home dialysis. There is a new machine, a new technology which is called Next Stage. You can learn to do your own hemodialysis. There is another treatment which is called peritoneal dialysis, continuous ambulatory peritoneal dialysis, or dialysis done at night with the machine. The surgeon will put a catheter in your abdomen. Then comes the question about kidney transplant. Kidney transplant are two kinds. One is live related, the other one could be from another person who's willing to give you kidney provided it gets meshed with you. And then there's a cadaver kidney, that means somebody dies from an accident and the kidney could be transplanted into another human being who is needing a kidney because he or she is on dialysis. Shunt creation for fistula, AV fistula. This shunt is created in your arm, and that needs to have about 2 to 3 months for it to mature, so that the large needles which needs to be put in during dialysis could be put in dialysis. So some of the symptoms may be odd symptoms the patient may have, and those symptoms could be from itching. The calcium get deposited into your skin, and that can lead to some itching problem. Sometimes you can get an ulcers in your body, and they may not heal. Kidney patients have problem with the immune system. They can get victim of some slight infection which may not do anything to regular population, but if you have kidney disease, then you become victim of it. So overall, you need to do vigilance yourself, then bring to the attention of your caregiver, your doctor, and then relate your problem with him or her, and discuss this thoroughly. Write down everything which you don't understand on a piece of paper when you go to the doctor, and go on your list and talk to him, discuss with him. All the nephrologists and the other doctors, they are happy to answer all your questions you may have. Thank you very much for your attention. Hello, my name is Naseem H Siddiqi. I'm a nephrologist at Knoxville. I'm giving this talk for the public awareness of kidney disease, Today's topic is end-stage renal disease. End-stage renal disease means that your kidney functions cannot sustain your life. So therefore you need some help such as dialysis or kidney transplant. There are multiple causes of kidney disease. When you reach stage 5 kidney disease, your body cannot continue to function as normal. Therefore, you develop fluid in your legs and fluid in your lungs and other complications as a result of it. So therefore, your doctor or a nephrologist will tell you that you need to start preparing yourself for a shunt. A shunt is called a arteriovenous fistula. The surgeon joins the artery and the vein in your arm, and your vein get bigger and larger so that when your time comes for dialysis, that nurses can put larger needles in your arm and can run the blood through the dialysis machine and return the blood back to you. It's imperative that you get that done in advance if you have time for it, and therefore a fistula will work for you forever and ever. Whereas if you just have a catheter in your neck area or in your chest area, that catheter may not work as well. It will not give you as much blood flow for the machine, as well as you are susceptible to infection, and we are worried about the blood getting contaminated with infection, and one can die from it. The other kind of dialysis is peritoneal dialysis. God has given us a third kidney, and the third kidney means that we have a peritoneal membrane inside our belly. All our organs are covered by semi-permeable membrane. Our BUN and creatinine and all the impurities get filtered out through that. That's called peritoneal dialysis. Then the third treatment is kidney transplant. Let me start with hemodialysis. Hemodialysis means your blood goes through the machine and get filtered out. It's not simply filtration. It also has that it filters out certain things, and certain things it takes from the dialysis fluid, and that way it is important. The history goes back to 1939 when the kidney machine was invented. It was like a washing machine that you see, but then now there are a lot of improvement on it, and then the AV fistula has been God sent, because after AV fistula a lot of patients are getting dialysis and then they're not getting more complications like they used to have. Dr. Scribner from Washington State was the major scientist who had started a shunt. Then AV fistula was refined by putting the tubes in your veins and artery under the skin. Over the skin initially, then they are now joined and the good veins are shown up, and when the fistula matures in about 2 to 3 months, then it's ready for you. Until such time, if you need dialysis immediately, then a catheter will be placed in your neck or in your upper chest area. This catheter should be removed as soon as your fistula is ready. Therefore, it is important that if you have a chronic kidney disease and it's reaching the end stage, that you should consult your nephrologist, who will advise you to get a fistula made through a surgeon who are called vascular surgeon. There are in centers that you can go to the dialysis center and get dialysis 3 times a week, 4 hours each time. Usually it will have no side effect, but some of the patients may not feel as well after dialysis. In the past, the doctors did not put everybody on dialysis because there were very few machines. Now there are many more machines available, and then everybody who needs dialysis, the doctors will decide that if you need dialysis, you will start getting a shunt made as well as ready for dialysis. There is another, this is in-center dialysis, but you can do home dialysis. There are some machines which are invented nowadays for home dialysis. The patient does his or her own dialysis, but we need a partner for that. A partner could be a wife or could be a friend who could help you to get on the machine about 5 times a week, sometimes 4 times a week, that you get on the dialysis about 3 hours or so, depending upon what your needs are. Usually your kidney functions are less than about 5 to 10%, and you are symptomatic that the doctors will put you on dialysis. There is a training program for home dialysis, so you go through that training. Usually it takes about 6 weeks to 2 months time that you become good at it, and then you will start doing the home hemodialysis. For this, you have to be very good at a sterile technique, and you should do everything right, and then it becomes successful. And in the long run, you do better with home dialysis than in-center dialysis. There is another home dialysis program, which is a peritoneal dialysis. We put a catheter in the abdomen, and the catheter, it takes about 2 weeks for it to be ready, and we put the fluid back and forth about 4 times a day. Once you become more proficient, about a month or so, then we do the dialysis at night at home. At home, you hook up yourself up to a machine and you go to sleep, and the machine does the job as we program the machine. Usually you learn how to do it yourself. And then you need a partner as well, and the partners will help you in case you get sick. Usually the patient does his or her own dialysis. Then there are, this is a better program than hemodialysis in-center program, because you have more freedom. You can go on vacation. You need to have a neat house as well as some area, storage area, and have a good electrical outlet as well. Then I put a light on the transplant. There are 2 types of transplant. One is a living kidney transplant, the other one is cadaveric. Living is better. You can ask your brother or sister, father or mother, if they are not too old, to give you a kidney. Usually donating kidney is not big deal, but some patients may in the long run have some proteinuria as well as have hypertension. So therefore you need to talk to them at great length and see how much sacrifice they want to give you. Nowadays we take the kidneys from the some relatives, other relatives besides your brother, sister, mother and father, and sometimes the friends can give you kidneys. Sometimes your spouse can give you kidney, depending upon the person and the cross matching. The cross match has to be done, make sure that everything is okay. Sometimes you have a relative or somebody who cannot be matched with you, and sometimes we use another patient whose relative may not match that patient, and we can cross transplant each of you. So in other words, your relative or your person who is donating the kidney may not match with you, but will match with another patient, and vice versa. The other person has a relative who does not match with that person and matches with you. Sometimes this kind of set of 3 patients have been done recently. There are some church members who will like to donate the kidney. They also do that. It's a great sacrifice they give. They are very well motivated. Then there is a cadaveric transplant. That means somebody has died of an accident, and nothing else can be done for them, and they will die otherwise. So we doctors evaluate them in the hospitals, and then the family signs a consent, and they donate the kidney to the person. It's not only kidney transplant is done that way, but heart transplant is also done, and the lung transplant is also done. Sometimes liver transplant is also done from cadaveric kidney. You need to sign your driving license that you will donate the kidney, and then you could let your relative know that in case you die because of accident or some other unforeseen reason, then you are willing to give your kidney, so that they are aware that you will be able to give your kidney in case you die. So that cadaver transplant is done quite efficiently. Previously they used to fail a lot, but now with the new medications, the transplant survives a long time. Of course, you have to take some medications to get the immunosuppression done, because our body rejects a foreign body. And of course, after you have a kidney transplant, they give you medication that includes the steroid as well. Sometimes you can get problem with obesity because of steroid, and sometimes you can get problem with diabetes also. A large number of patients who are victim for kidney failure, they are because of the diabetes sugar problem. And so it's very important for the local general population that they should be aware of getting their diabetes under control and get your blood pressure under control, so that you don't get into problem with end stage renal disease. There are some infection which for which you are susceptible because of the immunosuppression, and so the doctors will advise you accordingly. So the kidney transplant is the best treatment. Then peritoneal dialysis is good treatment, and then if you have to go on hemodialysis, then the home hemodialysis is a better treatment for you. And then if you don't have any of these available to you, then the in-center dialysis is for you. In the past, they used to have a committee of doctors in Seattle, Washington. They used to decide which one will go on dialysis and which will not. So thank goodness the time has improved, and now we can give treatment for kidney disease as is needed. If you have any questions, you need to ask your own doctor. I'm not treating you right now, and you need to get your own nephrologist who will advise you further in your given situation. It's very important that even if you are on dialysis or kidney transplant, you need to get several medications that the doctor may prescribe to you. So you cannot just say that I got a kidney transplant, I can go free. That's not true. You have to stick to the diet as well for it, and you have to maintain a good fluid balance. Thank you very much. Thank you for your attention.